Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
A year ago for dental examination. Her chief complaint involved the appearance problem relative to her upper front teeth. Also, she had a fairly serious problem of inability to properly chew food, and with a consistent complaint of soreness in the upper right edentulous ridge area. These complaints primarily related to early tooth loss with additional migration of teeth and the basic problems covered in the chief complaint. We'll take a look at the original diagnostic cast mounted on an articulator and show the problems that she presented with and the treatment program that was outlined for her. Looking at the cast in the functional position on the articulator, this lower right segment was occluding into the soft tissue of the upper arch, and it was our decision in treatment planning to remove these teeth with the alveolar segment to create adequate room to place a partial denture in the lower arch. We also were going to remove this little segment of bony alveolar structure in the upper arch. On the left side, we had another space problem, and it was our decision to reduce the tuberosity area, take these upper teeth out, the last remaining posterior teeth, remove those, and again create inner arch spacing. The 4 incisor teeth were to be removed later, and an immediate insertion maxillary overdenture would be constructed. Now we'll take a look at the post-surgical mounted cast to see the changes that were initiated before reconstruction was begun. The surgical reduction of the right side has created adequate inner arch clearance for our dentures. The left side tuberosity reduction and tooth removal has created adequate space on the left side as well. Going to the lower cast now and looking toward the restorative changes that will be made. These 2 abutment teeth will be splinted with ceramic crowns, and the left side abutments will also be splinted with ceramic crowns to close the space between the 2 of them. And the lower partial denture will be constructed to oppose our maxillary complete overdenture. Now we'll take a look at the patient. This is Mrs. Hentrell, 1 week post-surgical. We placed her upper complete denture and her lower partial last Tuesday, and we have her back now to take a look at the completed treatment. Would you just count to 10 for us?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
And how about another large smile like that before? Okay. Okay. Now then, let's do the same thing from the side, if we may, and count again from 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
And how about a smile again from that position? All right, very good. Now we're going to place the retractors, and we'll take a look at our denture and our partial denture as they come together and function. If I can get those again, I'm at a little bit of a weird angle. All right, now would you close right together on the back, please, and tap up and down a couple of times, all righty? Now, keeping the teeth right together, would you slide out toward me? Slide the lower jaw. Okay, that's good. Couldn't do that last time, but now then, tap again in the middle position and slide the opposite way. There we go. Back again. Now rub back to the middle. Now slide straight forward. A little further out. A little further out. Oh, I'm sorry. Pulled that a little too much. Now let me go back and get that again. My left side retractor has failed me there. All righty, let's do that just once more time. Quickly, we'll go forward and then back to the middle position, to the right, and far over to the left. All right, and then back to the middle. All righty, now let me just take those out, and we'll remove the upper denture and the lower partial and take a look at our mouth preparation. Now let me just remove this. All right, partial denture and the upper. All right. Now, just 1 week from surgery, we may still have some soreness in the upper, so I'll try to be careful with the mirror. And if we can open wide, we'll take a look at the lower first, and we can come right close in on that. Now, in our program for treatment, we were splinting the posterior teeth on either side, bicuspid and cuspid with ceramic crowns, preparing the foundation for the partial denture. And in the upper arch, we were close just a little bit, Miss Hendrell, please. Take the pressure off that. We were going to save the two cuspid roots and do an overdenture. And as we see, the roots are still intact. She's still healing some, but our upper arch is coming along very, very nicely. And I believe that is really all we wanted to show. Let me put these back in. The partial sits in there very nicely. And I'll try to slip this one back. There we are. I didn't bruise you too badly, I hope. All right.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.